When is the best time to sign up for Medicare? If you're going to continue to work, should you take Medicare or group insurance? We're going to take a look at this. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. Okay, this has been a year where it seems like everybody, well, not everybody, but a lot of folks have tried to enroll in Medicare their way, and it's not working out real well for them. So if you're looking down the road at 65 and you're trying to decide, and you're going to continue to work especially, but if you're looking down the road at 65 and you're trying to decide, should I enroll in Medicare, should I stay on the group plan, what should I do? This will address some of the questions that you have. I can't address all of them because if I did, this would be a 25-minute video and nobody would watch it. So we're going to try and hit some of the highlights. One of the biggest challenges that people have is their spouse doesn't have the same birthday that they do. And sometimes one of the individuals is turning 65, the other one is maybe 2, 3, 4 years younger, or 10 or 15 years younger. So, what do you do? Well, basically, if you're looking at 65 and you have a younger spouse that is within 18 months of going on Medicare, becoming Medicare eligible, one of the things you might want to look at, rather than continuing the group insurance plan so that he or she can stay on your plan, but one of the things to look at is COBRA. And I know a lot of people think, well, COBRA is crazy expensive. Well, it's nothing compared to Obamacare. So COBRA is an option, again, if your younger spouse is within 18 months of going on Medicare. And all of these scenarios I'm going to touch on. Feel free to call me or email me, and I'll be glad to kind of talk you through it here, because it's not an easy, cut and dry, black and white type of thing. But consider COBRA. There are other options, of course, but more often than not, COBRA is going to be a better choice than continuing to cover both of you under the group insurance plan. All right, let's just talk at you. Let's say whatever the situation is, but you're the only one. You're the one that's going to be turning 65. You want to continue to work, and a lot of times people say, well, I like the group plan. It doesn't cost me a whole lot. I think I will just continue on the group plan rather than enrolling in Medicare. You can continue to work. You can stay on the group plan. You may be better off to enroll in Medicare, though. And I'll tell you why. I can give you some examples. I've had more than one person this year that decided to, well, yeah, I'll just continue to work and keep my group plan, and I'm not going to worry about anything else. Well, sure enough, in one case, a person fell down and broke a number of bones. In the hospital for about a week, including intensive care, had 2 or 3 surgeries, then was discharged to a rehab center. This individual is looking at about $150,000 or more in medical bills. And with the group insurance plan that they have, that person is 67, 68 years old, something like that. So they had a choice to go on Medicare a few years ago, and they chose not to. So instead, they kept their group plan, and with this unfortunate accident that happened, it could happen to anybody, but it was a pretty serious fall. And in this particular situation, he's going to be looking at probably a minimum of $5,000 out of pocket, and probably even more than that. And all because he kept his group plan. Had he gone on Medicare, he would be looking at, now this is 2020, he would be looking at Medicare Part B premium, about $150. He would be looking at a Medicare supplement premium for Plan G, plus a drug plan, about another $150. So he's looking at $300 a month for a plan that allows him to use any doctor, any hospital, anywhere in the country. There's no networks, it's no managed care, nobody looking over your shoulder and saying, well, we really think you need to leave the hospital. This is costing us too much. And of course, the best part is his out-of-pocket for all of this would be less than $200 a year, or $200 during the calendar year, as opposed to, like I said, $5,000 or more. That kind of difference right there, I mean, you're looking at $1,500 a year. For the last 3 years or so, that's he's eaten up any savings that he may have had by staying on the group insurance plan. So of course nobody knows, but that's one of the things. So if you're looking at continuing to work past 65, trying to decide if you want to go on Medicare or the group plan, these are a couple of different situations where you might want to talk about it. This is Bob Vineyard, your Medicare expert with the Georgia Medicare Minute. You take care. Have a great day.